Do you lose a lot of blood when you do liposuction? I'll tell you a funny story. So when my dad, he was one of the first people in Utah to do liposuction. This was back in the early 1980s when people were going to have liposuction surgery. They would come to the hospital and they would donate 2 units of blood. And 3 weeks before they were going to have surgery, they would go in there and they would suck out all that fat, but it tended to be really bloody, and people lost a moderate amount of blood when they did that liposuction. And then in the recovery room, they would transfuse them back, those 2 units of blood. I know it sounds totally crazy. In the late 1980s, early 1990s, liposuction started to be done with what's called tumescent solution. So before we go in there and suck out the fat, we inject the tissue with a solution called tumescent solution, which helps all the little blood vessels to constrict down. It helps separate the fat cells, so it's easier to remove those fat cells, and it makes liposuction a lot safer. So there's very little blood loss now with liposuction. We still err on the side of not removing more than 5 liters of fat from someone in any given setting. That's the standard recommendations from the American Board of Plastic Surgery, and we always stick to that. Liposuction is not a weight loss procedure, it's a contouring procedure, but it's a very effective contouring procedure.